Minnesotans are stepping in to help find a way to treat COVID-19 as more people become sick.
In just the last few hours, Wisconsin reported its first 2 fatalities from the virus. A man in his 50s and a man in his 90s died. Out of thousands of tests, Wisconsin has 155 positive cases.
There are 89 known cases in Minnesota, but the state health department says that is just the tip of the iceberg. Many others are sick, but there aren't enough resources to test them. Today, President Donald Trump ordered the FDA to fast-track 2 drugs to treat COVID-19. The University of Minnesota is testing one of them right now. Our Marielle Mohs is live at the U tonight with how their work could help this outbreak. Hi, Elle.
Hey, Amelia. In this building behind me, U of M researchers are working to come up with an antiviral drug that they hope will prevent people from getting sick from COVID-19, and another antiviral drug that they hope will cure people who are already sick from the virus. And right now, they are looking for participants who are willing to take this drug and test it out.
Antiviral medications are, there are a lot of them. There just aren't any at the moment for SARS-CoV-2, the cause of COVID-19.
Tim Schachner is an infectious disease doctor and vice dean of research at the U of M Medical School. He and his team have been leading 3 antiviral COVID-19 trials. 2 of them have already started testing antiviral drugs to reverse the symptoms of COVID-19, and the other to prevent someone from getting sick if they test positive for COVID-19 but are not showing symptoms. The 3rd trial they are doing is to prevent someone from getting COVID-19 who is directly exposed to it. This trial hasn't started yet, but they are looking for 1,500 participants to take this drug who have direct contact with people who have the virus. If successful, this drug would allow people like healthcare workers to continue to do their work without the risk of getting sick themselves.
That would be a game changer. That would be huge.
Dr. Schachner hopes this research can lead to similar success that the medical field saw with HIV.
In 1984, we had nothing, absolutely nothing. AZT, the very first antiretroviral, came along in the late 80s, and now we have 30 plus antiretrovirals.
And while all of us are quarantined and practicing social distancing right now, these U of M researchers are risking exposure for the sake of finding a cure.
We've got to see the patients. We've got to be with the patients, and that's just the only way we're going to get this done.
And to be eligible to take this study, you had to have had high-risk exposure to someone with COVID-19 in the last 3 days. Of the 1,500 participants, half of them will get the antiviral drug. The other half will get a placebo vitamin. If you're interested in signing up, we'll have all the information to do so on WCCO.com.
All right. Thank you, Elle.